Okay, this video is called Scared Healthy, and it's a bit of a parody of Scared Straight, because I was talking to one of my healthcare buddies, and we're like, it's so obvious low-fat vegan with no oil is the way to go. I said, it's easy for me to be motivated. I like the diet, but the main thing too is I'm scared of all these diseases. All day long I look at crash and burn, train wreck, disaster patients. They're all screwed. I feel sorry for them. I want to help them, but they've already gone down this path of, drugs and surgery, drugs and surgery. That's all they're interested in. Good luck. Okay, here's a nice looking normal aorta of the abdomen. Abdominal aorta, right renal artery, left renal artery. Good looking vessels. Common iliac artery going to the legs, internal iliac artery supplying the vessels to the Johnson. Everything is good. Now here's a typical looking patient that I see in the USA, middle-aged and older. Extensive calcifications of the abdominal aorta from atherosclerosis. Note there's no calcifications over here. Calcifications throughout bilateral iliac arteries. These are the common iliac arteries, internal iliacs, external iliacs. This is crap. So this guy has terrible blood flow to the Johnson, probably impotent, lousy blood flow to the legs, probably has intermittent claudication, pain while walking. Calcifications in the superior mesenteric artery going to the gut. He's at risk for ischemic bowel. Other gut problems, it's bad. And this is typical. This is just typical. They wonder why things don't work well. It's because there's no blood flow. All right, here's a typical looking spine stuff. This would be like a typical looking 25-year-old, beautiful spine. All the disc space heights are intact. There's no disc herniations. Vertebral body heights are all intact. Wide open spinal canal. And here would be like a 65-year-old with extensive arthritis. Degenerative disc disease. All the discs have a loss of height. There's abnormal end plate signal, Modich type changes it's called. Many of these discs have Schmorl's nodes where the disc is herniated into the vertebral body end plate. That can even be something called a limbus vertebra, but there's a crappy looking spine. At every level there's disc bulge or disc osteophyte complexes causing narrowing of the spinal canal, not much fluid anterior to the nerve roots. So probably about moderate central stenosis here, moderate to severe central stenosis here. These are patients that are in a lot of pain. They don't have much muscle. They're often kyphotic, walking hunched over, pretty soon on a walker. Their back is weak and stiff. You want to be like that? I don't want to be like that. You don't have to be like that. I'm 61. I run up and down the stairs. I can squat, my body weight for over, how many times? I've squatted my body weight for 100 reps, okay? So you don't want these problems. All right, here is a nice normal looking brain. You can see the brain is uptight against inner table of the skull. Small ventricles. This is what's called a flare sequence. Flare just means T2 weighted with CSF suppression. So you suppress the signal of the fluid from cerebral spinal fluid in the ventricles so it's dark. Okay? Anyways, nice tight brain. The sulci are small. And here's what it looks like on an older brain. This would be like a typical 75 and up patient with a bunch of little strokes. These are called the deep white matter areas, and these are typically silent strokes, meaning that they don't usually cause hemiplegia, loss of an arm or a leg, but they make the patient progressively slower mentally. Pop, pop, pop. And this is what I mean by you could have 100 strokes in one patient, because look, if you try to count them, let's just try to count a few of them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. And they're becoming more and more coalescent, and there's a whole bunch of them at all the other levels too. So you see what I'm saying? One patient could have 100 of these little silent strokes. You don't want this. How do you avoid this? They're mostly caused by diabetes and hypertension and atherosclerosis. That's all kind of the same disease, all right? And where do you get it from? High fat, high sodium diets. From not eating enough plants, okay? So eat your plants. It's not rocket science. I don't want my brain to end up like that, be fat, sick, and stupid. Like, most people in the USA are after 55. They're fat, sick, and stupid. Not frankly demented, but they're headed that way. And many of them are demented. Okay, here's a typical demented brain. You can see that the brain is not uptight against the inner table of the skull. There's a big expansion of the cerebral spinal fluid space along the convexities. And that's because this brain is all shrunken and atrophic. It's retracted downward. Alcoholism will shrink the whole brain. Most commonly, though, it's just due to atherosclerosis risk factors, and they don't get enough oxygen and glucose to their brain. They're hyped up on stimulants. They can't meet their metabolic demands. They got mitochondria inhibited by all the mitochondria inhibitors. The brain cell just says, screw it, I can't continue. And it dies, goes into apoptosis. Recycle me. And the macrophages come in called microglia, and they just eat up the brain cell. You lose enough brain cells, you're going to lose the memory that's stored on them, and you progressively lose your memories, become demented. So again, these are not rare things. What I'm showing you is things I see all day long, every single day. Okay, here's a patient with atrial fibrillation. I'll sometimes form a clot in the left atrial appendage, for example. It breaks loose, goes up to the brain. Here it is going up through the internal carotid artery of the brain, go to the middle cerebral artery, MCA. Big stroke. Okay, here's a big MCA stroke here. And it's in the right frontal lobe and the right parietal lobe. In the MCA territory, middle cerebral artery territory. Same stroke as what's illustrated in this picture here. This patient is going to be cognitively impaired the rest of their life and is going to be, weak on the left side of the body, if not fully plegic. Okay, it's a terrible big stroke. I see these all the time. I mean, don't get me wrong. Most commonly, I see a shrunken brain, but I see lots of these big infarcts too. Atrial fibrillation, super common. Okay, now here's a patient going for an ablation procedure in the left atrium for their atrial fibrillation. And they've got a ring circular catheter outlining the pulmonary vein, and now they're going to burn lesions in the periphery of the pulmonary vein because that can help improve the conduction of the cardiac impulse through the atrium. So it's more coordinated to improve coordinated filling of the ventricles so you have a better cardiac output of pumping of blood to the body. And what I'm telling you is, I don't know about you, I don't want anybody burning holes in my heart. I really don't. I would rather have they keep their catheters to themselves. The only way you can keep the cardiologist out of your heart is take good care of your heart. Eat the low-fat vegan with no oil. You remember the joke about $100 for doctors? How do you hide $100 from an internal medicine doctor? You hide it under a surgical dressing because they're real squeamish, kind of wimpy. All right? How do you hide $100 from an orthopedics doctor? You put it in the chart. Now, it's kind of teasing because the joke is orthopedic doctors are stupid. They're just a bunch of carpenters, and they never look in the chart. They don't care about clinical medicine. They just want to do their carpentry on the patient's joints, artificial joints. Okay, so that's the joke there. How do you hide $100 from a cardiologist? So the joke is you can't be done. It can't be done because they're so money hungry, they'll figure out a way to get money out of you no matter what. How do you hide $100 from a neurosurgery resident? Tape it to his kid's forehead because they never go home. They're screwed. It's one of the worst fields of medicine because I feel sorry for neurosurgeons. I'm always very nice to them because they have like the worst hours. They get called in all the time on weekends for emergency intracranial bleeds, traumas, subdural hematomas. They get sued a lot. It's kind of miserable, okay? And then their wife spend all their money and divorce them, okay? So it's a rough life for neurosurgeons. I feel sorry for them. And believe me, I've met a lot of them in my time. They have a tough life. Whenever I feel sorry for myself, I say, I could have been a neurosurgeon. It's not that bad. Okay. So anyways, here are the 5 wounds of the village idiot. And these are the wounds from open heart surgery. Here's the midline sternotomy of the sternum. Here is the cardiac cath, done soon before. We'll have a sheath in the artery, common femoral artery, common femoral vein, going up into the heart for the cardiac cath, measuring the pressures. They're going to have a mediastinal tube here. They're going to have a left-sided chest tube in the pleural space. They're going to have a right internal jugular vein, Swan-Gaines catheter, measure pulmonary artery pressures and whatnot, manage the patient in the ICU initially. And so what I'm saying is, why would you get this procedure for chronic coronary artery disease, cardiac angina, when you can just go low-fat vegan? Get better results, not have to shell out $150,000 and not put yourself at risk for all these complications, including pump head, cognitive impairment. Okay. Cardiac stents. Same thing, they're built for about $60,000, and both stents and open heart surgery, they really don't do much. They don't increase longevity for treatment of chronic coronary artery disease, stenosis, and angina. Okay, typically, here is open heart surgery. They got the big retractors, big rotating circular buzzsaw cuts open the sternum, then you retract the sternum so they can get access to the heart. And I don't know about you, but I don't want anybody to take a rotating circular buzzsaw and cut open my sternum. I know in America this is now considered normal, but I got a little secret for you. It's actually not a normal thing to do. And why have it done when I can get better results with a low-fat vegan diet? Hospitals love this procedure. They make tons of money, $150,000. I told you when I was in private practice, a cardiologist screwed up a case one time, and I talked to another radiologist. I said, this guy screwed up the case, man. He's an idiot. He messed up an easy case. And the other doctor goes, no, you can't ever criticize cardiology or cardiac surgery. They bring the most money to the hospital. It doesn't matter what happens. If you ever complain about a cardiologist or cardiac surgeon, anybody who complains will get fired, not them, because the hospital needs them for money. That's what private practice hospitals are like. Okay, now here's typical look at some cardiac surgery graphs. And basically, you'll hear some people say, I had a single vessel CABG, double vessel CABG, coronary artery bypass graft, triple vessel CABG. You know, this is a Lima to the LAD, left internal mammary artery plugged into the left anterior descending artery. Okay, here you've also got a vessel going from the aortic arch to the right coronary artery. All right, and here you've got one also going to a diagonal branch, and here you got one going to the circumflex artery. All right, so single vessel, triple vessel bypass, whatever. The point I'm making is, you know, the William Roberts papers have shown you can't treat the microcirculation with this procedure. You can't treat the lesions that are most likely to cause myocardial infarction because you can't see them on cardiac cath. All you can do is bypass the chronic fixed stenoses, and you can get some decrease in the symptoms of cardiac angina, usually not that much, no significant change in longevity with this or stents. Why would you want to do all this stuff when you can easily go low-fat vegan? Okay, that's what I would do. All right, now here's from a lecture of Dr. Mcdougall. And Dr. Mcdougall has a very good lecture. I recommend you to watch it. It's at his YouTube channel, the Dr. Mcdougall Health and Medical Center. And this is called Heart Disease and the Hidden Danger of Ruptured Volatile Plaque. So here's again showing the diagram. What they're bypassing is a high-grade stenosis, okay, and let's say in the right coronary artery and the left anterior descending artery. And you can bypass the high-grade stenoses, but you can't see the smaller ones, which are the ones that almost always rupture and cause heart attack and death. And that's why it doesn't reduce your risk of death from a heart attack, nor does stent. So it's a pretty overrated procedure. Go through all that, pay all that money, and you don't fix what the patient's most concerned about. All right, here's just showing that red blood cells are typically about 7 microns. Capillary is about 5 microns. When you eat a high-fat diet, you stick them all together, and the blood becomes thick. That's called blood sludge or rouleau formation, stack of coins, that means in French. And so the red blood cells have a negative charge on the periphery. That's called a zeta potential. Bridging molecules like LDL cholesterol, IgM antibodies, fibrinogen, the clotting protein, uric acid, they'll overcome the zeta potential because they're positively charged and big enough, and they'll stick the red cells together. Okay. Very nice video again at the Dr. Mcdougall YouTube channel, where he shows that if a person eats a high-fat meal, he did this work with Roy Swank, the red blood cells all start sticking together. You can see him in this picture. This is a paper by Roy Swank. The red blood cells start sticking together, and then when you're pumping, you know, you have a blood pressure, you're going to pump blood to the top of your brain, your cerebral cortex, pumping it against gravity. Normal blood's like water. When you have the red cells stuck together because of fat, it becomes like a milkshake. So you're pumping a milkshake to the top of your brain. Pressure has to go up. You eat sodium, you vasoconstrict the arteries, they're narrowed. Now you're pumping milkshake through a tight system, constricted system, pressure has to go up. So that's why salt and high-fat diets cause high blood pressure, okay? I recommend you watch that video. It's only 50 minutes long. It's called Blood Sludge, Blood Flow, Before and After Eating a Fatty Meal at Dr. Mcdougall's YouTube channel. Okay, the higher your LDL cholesterol, the thicker your blood. That's why cholesterol is the #1 risk factor. Cholesterol and hypertension are the 2 main risk factors for atherosclerosis. Anything that makes the blood thick increases your risk of atherosclerosis. Anything that raises blood pressure increases your risk of atherosclerosis. Because high blood pressure damages the arterial wall, which leads to forming clots inside your arteries. And it doesn't matter what type of fat. All the fats, they're going to be more atherogenic. If it's MUFA, if it's PUFA, if it's SAT fat, okay? I've gone through these research papers a whole bunch of times. The Peter Quo research papers, the Roy Swank research papers, the Meyer-Friedman, Ray Rosenman research papers. Okay, by the way, here's actually from the Ray Rosenman and Meyer-Friedman paper. And what they found was the same thing. They were able to look in the patient's eye, and they could see losing blood vessels after the high-fat meal. You don't want that, okay? And, you know, a lot of it comes back, but why risk occluding a small vessel with all that blood sludge? Not a smart thing to do on any type of routine basis. Here's the Windkessle effect. Abdominal aorta, when the left ventricle contracts, it stretches the ascending thoracic aorta outward. Then there's elastic recoil during diastole that maintains diastolic flow. Okay, as people have chronic hypertension for decades, they destroy the elastic fibers in their ascending thoracic aorta. These can't be replaced after maturity, after 20-something years of age. So what ends up happening is the patient gets more and more diastolic. They get more and more systolic hypertension because they can't generate adequate diastolic flow. So the pulse pressure gets wider. The distance between the top number, systolic number, and the diastolic number and blood pressure, you get wider and wider, widened pulse pressure. is what that's called, because of the loss of the Windkessle effect. Well, Windkessle is that thing that you, like an accordion, you blow air on the fire to sort of stimulate the kindles to burn. Okay, looks like a little accordion. Okay, here is high blood pressure. So normal blood pressure has a sort of a parabolic velocity profile, red cells in the center, white blood cells adjacent, then plasma out here. It comes up a vessel like common carotid artery, hits the median divider at the branch point, and then it bounces off of that. If the pressure is excessively high, you get more and more of this turbulent flow bouncing off of there. Increased turbulent flow causes activation of platelets, making them more prothrombotic. You also get these slow retrograde eddy currents, right, indicated by this arrow right here. And these slow currents, they confuse the endothelial lining of the artery, and this is the internal carotid artery. And it'll then sort of shed its glycocalyx, and its prothrombotic adhesion molecules will be exposed, and the red cells will bind to them, and you'll start to form clots. And this is where you almost always see the clot beginning, opposite of the median divider. So throughout the body, this is where atherosclerosis happens, from high-fat diets, high-sodium diets, and leading to hypertension and blood sludge, and you start forming clots opposite of the median divider here. That's typical atherosclerosis. I see that every day, and that's exactly what it looks like, and Dr. Gregory Sloop figured that all out. Okay, here's from the papers of Jack Delatorre. I call them the mouse equivalent papers, the vascular hypothesis of dementia due to hypoperfusion, lack of blood supply to the brain. Basically, he tied off the artery in the carotid in the neck of a mouse, and then 2 months later, the mouse, middle-aged and older mice, will become demented. He opened up the skull, the autopsy, expecting to see a big stroke, but he just saw a shrunken brain on the side that was tied off. So this side tied off, you're going to get a shrunken brain there. All right, and he experimented with it. He tied off both of them. He tied off the middle cerebral arteries, etc. He tied off everything, the verts, everything. And he kept coming up with that same thing, that when you drop the blood supply to an area in the brain, it gradually, those brain cells start dying more and more over time. And by the time 2 months go by, that brain is quite shrunken in that area, and the mouse is behaving as a demented mouse. And so people will say to me, oh, so what? Not that many people have severe stenosis or occlusion of their carotid artery in the neck. And that's true. But guess what? Tons of people have AFib, chronic cerebral global hypoperfusion, increased risk of dementia. Tons of people got congestive heart failure, CHF, global hypoperfusion of the brain, risk of dementia. Tons of people got OSA, obstructive sleep apnea, cerebral hypoxia, diffusely, increased risk of dementia. Tons of people have diabetes, where they sometimes have severe hypoglycemia episodes because they give themselves too much insulin, for example. Okay, overtreated hypertension. Tons of people have hypertension, damage in those arteries causing atherosclerosis, the bifurcation. Lots of them overtreat their hypertension, drop their pressure too low, cerebral hypoperfusion, risk of dementia. Some got carotid artery stenosis. A lot of them got aortic stenosis, aortic regurgitation of the aortic valve of the heart. They can run them quite hypotensive after CABG because they don't want them to bleed out of their anastomoses. They did that to my father when he had a CABG many, many years ago. I didn't know any better at the time. I did ask the anesthesiologist why you're running them so hypotensive. And he goes, because we don't want them to bleed his anastomoses. I didn't like the thought, but I understood why. My dad came out of it fine, but my dad was a lot healthier than the average CABG patient. Severe anemia, okay, fine. Okay, here's just showing, the idea of a Goldilocks balance in the brain. Basically, if your pressure is too high, you'll shear off your lenticulostriate arteries. This is the middle cerebral artery coming up into the brain. This is the basal ganglia level. And you get lacunar infarctions here, little microbleeds, old cerebral microbleeds, all right? If you don't have enough pressure coming up, you're hypotensive for all these reasons we just talked about, then your convexity branches, which have the penetrating arteries in the brain parenchyma, don't get enough blood flow. They don't have good collaterals of this segment, and you end up with little strokes at the periventricular level and just above it. That's what I just showed you on that brain MRI with all those white spots, and that's why I got the skull and crossbone here. This is where by far you get the most of those. I see hundreds and hundreds and hundreds of these every day, okay? Tons and tons of stroke, endless number of strokes. That's why people say, oh, you got to be careful with cell phone. You don't want to get brain cancer. No, forget about brain cancer. Brain cancer is so rare, you could forget about it. Yeah, it happens, but I'll see, 100,000 strokes for every brain cancer I see. Strokes, dementia, that's what you should focus on because that's what's destroying people left and right. Brain cancer is a rare entity. Okay, so hypoperfusion of this segment due to overtreated hypertension, for example, not good. CHF, AFib, all that stuff. Okay, here's a patient who had severe uncontrolled hypertension, and they got a bunch of microbleeds in the basal ganglia. This is called an SWI sequence, susceptibility weighted imaging, which is hypersensitive. Doesn't have a refocusing pulse to diminish the effect of the hemoglobin. So when you get microbleeds from this, they show up really bright. I see these all the time. Now, don't get me wrong. All those small strokes are a lot more common. They're 100 times more common than this, but I do see this a lot. Okay, we talked a lot about leaky gut, lack of dietary fiber, then, all the toxic stuff, the F- in your water, the chlorine in your water, the alcohol, the emulsifiers in all the processed food, the cooking oils, all of these things. There's a whole bunch of things. I listed them all here, like 25 things that cause leaky gut. Leaky gut leads to neuroinflammation, leads to amyloid clotting, leads to bacterial endotoxins getting into the blood. They cause clotting. Same patients who eat that type of diet tend to be iron overloaded from the meat and from the iron fortified foods. And that causes amyloid clotting. It's bad. This is just showing these clots. Iron overloaded also causes the same thing. Okay, you get these vicious cycles of damage due to oxidative stress to your fibrinogen proteins, and they form these refractory to lysis clots called dense matted deposits. Douglas, Kell, and Etheresia Pretorius did the greatest work on all this. They deserve Nobel Prizes figuring out all this stuff with regard to amyloid clotting. Okay, you'll also get increased systemic inflammation. The high-fat diets cause activation of neutrophils. Neutrophils are about 2/3 of your red blood cells. I'm sorry, 2/3 of your white blood cells. And some of them will become activated and undergo what's called netosis, where they just throw their DNA out into the extracellular space. Let's say they've been activated by LPS, bacterial endotoxin, their toll-like receptor here, TLR, and they want to trap the bacteria, what they think is a bacterial invasion. And so they throw their DNA out. They commit suicide, basically. It's called netosis, neutrophil extracellular traps. And then they release all these intracellular antigens, and it's associated with autoimmune disease. It causes clotting. So you don't want netosis. You don't want systemic inflammation, because it raises your white blood cell count, which raises your blood pressure, trying to push those big cells through your capillaries. Red blood cells only 7 microns, and neutrophils 14 microns. So it's a big cell that push through your capillaries. The more fat you eat, the more fat gets into your cells, goes through by a flip-flop maneuver across the plasma membrane of your skeletal muscle cells, and it causes insulin resistance. Here's the paper right here, Anthony James and James Hamilton, 2020. Okay, diabetes is mostly accumulation of fat where it doesn't belong. This is the ectopic fat theory of Gerald Shulman. Accumulates in the skeletal muscle, causes post-eating, postprandial hyperglycemia. Accumulation in the liver disrupts the ability to manage blood glucose levels in the fasting phase, so you get fasting hyperglycemia. Over time, the fat accumulates in the pancreas and destroys the pancreatic beta cells. Now the patient's screwed, insulin dependent for life. And there's a lot of common complications. I have a whole bunch of diabetes lectures where I go through all that. Here's a patient getting a kidney transplant using robotic assisted technique. And me personally, I'm not impressed by robots. The average patient's like, oh wow, robot assistance and a laser, isn't that cool? I want the most high-tech version. I'm the opposite. I want the best, most experienced surgeon, okay, who knows what they're doing at a hospital that knows what they're doing, okay? And how coordinated are robots? That doesn't really impress me, okay? And the more the person's working through a small hole, it's going to make it harder technically for them to complete the operation. And getting a kidney transplant is no walk in the park. Kidney transplants have lots of complications. I've been involved with hundreds and hundreds and hundreds and hundreds of them. I've done drainage on lots of them. I've seen all the problems that they have. It is no walk in the park. A lot of them don't do well. Some of them do great, but a lot of them don't. So it's no walk in the park getting a kidney transplant. I would much rather protect my kidneys. Okay, here's a relatively young-looking guy on dialysis, okay? Dialysis is super common. Tons and tons of patients on dialysis. And why are most people in kidney failure? Hypertension, diabetes, atherosclerosis, autoimmune disease. Those are the most common causes. There's other causes, of course. Those are the most common ones, okay? No fun being on dialysis. 5 hours at a time, 3 hours a week. Okay, now I want to show you something called the one-eyed monster of medicine. So here's Polyphemus in the Odyssey. And Odysseus and his men were stranded on this island, and they have the Cyclops, the one-eyed monster, on top of the mountain there, and he eats men, so they're pretty scared of him. And then they figured out a trick on how to get the Cyclops. They got him drunk, and then when he was drunk, they ran a burning piece of wood through his eye to fight back against the Cyclops, who was killing them and eating them and going to kill and eat all of them. Okay, so what's the metaphor? What's the joke here? Here is the one-eyed Cyclops of medicine, the endoscopy scope, okay? And don't get me wrong, it can do a lot of useful things, but I don't know about you. I don't want a tube up my butt, okay? I'm having a nice day, and I don't want a tube up my butt. So here's the colonoscope, and these guys find a lot of stuff. And meat eaters, they find lots of polyps. I would much rather, vegans tend to not get polyps. I was a vegetarian, not a vegan yet, but I had a colonoscopy about 20-something years ago, 24 years ago or something like that. The gastroenterologist told me my colon was so normal it wasn't even funny. And I'm like, good. And I didn't realize it then, but the more I learned about nutrition, I said, you know what? I'm just going to go low-fat vegan and never get another tube in my butt. You can also put a tube up the butt for barium enema, okay? And notice how fat the technologist is in this case, okay? Lots of them are real fat because they eat a Western diet. And so, what I'm trying to say is healthcare workers don't know this. Tons and tons of fat doctors, fat nurses, fat secretaries, fat technologists, because they don't know the low-fat vegan diet. It's the most valuable thing you could know. I'm trained, I'm triple boarded and trained in the most high-tech medicine that there is. And I can tell you, there's nothing anywhere near as powerful as a low-fat vegan diet. And so I'm scared healthy. I don't want any of this stuff. I don't want any tubes up my butt. I don't want anybody cutting me open. I don't want to take any drugs. And I guarantee you, there's an unlimited number of doctors that want to do more procedures. You walk in there, you start telling them you got blood in your stool, your gut hurts, your belly hurts. You'll have a scope up your bottom, down your throat pretty fast, okay? I don't want to be double penetrated. Thank you. Here is the sigmoid colon being resected for cancer, but more often the sigmoid colon is resected because this is where you get diverticulitis most commonly, where you perforate a diverticulum due to chronic constipation from not eating enough fiber, because you're eating plants and you're eating, meat and junk food, okay? But I don't want a sigmoidectomy. I don't want diverticulitis. Very painful, okay? You don't want this stuff. I don't ever want anybody to operate on me. And so that's why motivation is not a problem for me. I like this diet, and here's what I say to myself. Okay, God, how can I avoid becoming fat, sick, and stupid and having people drug me all the time and put tubes up my butt and cut me open and I become fat, sick, and stupid? How can I avoid that? All I got to do is eat this plant-based diet. Okay, starches, fruits, veggies, just take a B12, methylcobalamin, get my sleep, get a little exercise, try to get along with people. I'll do it. Thank you. I'll do it. It's the greatest deal you could ever get.